Hello, and welcome to my presentation on gastric dilation and volvulus in canines, a life-threatening emergency. Gastric dilation and volvulus, or GDV, is a life-threatening emergency in dogs. In simple terms, the stomach fills with gas and then twists on itself, cutting off blood flow. The stomach, a monogastric organ, rotates along its axis, trapping the gas inside. This pathologic rotation compresses the mesentery and blood vessels on the ventral abdomen, causing the stomach's mucosa to die from lack of oxygen. The twisted stomach blocks blood return to the heart, triggering hypovolemic shock. Large, deep-chested breeds like Great Danes and German Shepherds are most at risk, and here we can see a normal versus bloated dog abdomen. Prevention is critical. You would feed multiple small meals daily instead of one large meal. Use slow feeder bowls to prevent rapid eating, avoid vigorous exercise immediately before and after meals, and consider prophylactic gastropexy surgery in high-risk breeds. Dogs often become anorexic or refuse food when GDV develops, so recognizing early signs like distended cranial abdomen, non-productive retching, and restlessness can save lives. Now we'll discuss some diagnostic testing. To confirm GDV, veterinarians utilize abdominal radiographs showing the classic double bubble appearance of the gas-filled, twisted stomach. Physical examination reveals a tympanic abdomen distended on the lateral sides. Blood tests often show hyperoteinemia from blood shifts and shock. If visceral organ damage and peritonitis is suspected, abdominicentris inserting a needle into the abdomen to collect fluid may be performed. The radiograph is a definitive diagnostic tool. And now we will discuss emergency treatment. So treatment has three phases. First is aggressive IV fluid resuscitation, which combats shock. Bilateral large bore catheters are placed in the cephalic veins, and crystalloid fluids are given at shock rates. Antiemetics medications are administered intravenously to prevent vomiting. Second, gastric decompression using an orogastric tube passed from the mouth into the stomach releases the trapped gas. If the tube cannot pass through the twisted area, a needle may puncture through the abdominal wall to decompress it. Third, emergency surgery is performed through a ventral midline incision extending from the cranial to caudal abdomen. The surgeon untwists the stomach, removes necrotic tissue, and permanently attaches the stomach to the lateral abdominal wall, called gastropexy, to prevent future rotation. And lastly, we'll discuss medications and recovery. All medications during acute GDV are given via the intravenous route, including fluids, pain medications, antiemetics, and antibiotics, if peritonitis or gastroenteritis develops. IV administration ensures rapid absorption when gastrointestinal function is compromised. Post-operatively, dogs are monitored for complications. With prompt treatment, dogs may survive and return to normal lives, but time is critical and every minute counts. And here we have our index of our terminology that was used throughout the presentation and our reference slide. Thank you!